And I think
that is the scary. It is scary. Right. It is.
Now, I want to throw a little statistics out there. This is the 2013, my Bible, as I always say, the 2013 Harlem Hospital Community Needs Assessment. The New York City Department of Health, and we're going to go back to some data in 2011. It says that they have confirmed that in the Morrisina area of the city, it has the highest mortality rate of HIV disease. So, and that's in the Bronx, we were saying earlier, right? So that area in the Bronx has the highest mortality rate of HIV in the whole city. Then it says Central and East Harlem had the highest mortality rates in Manhattan. And the thing that really upsets me is that we were talking about this when I first started on the show. We were talking about looking at statistics from like 2006 and 7 and 8 and 9. They were saying that this area in New York, the Harlem area, has the highest mortality rates or the highest rates of HIV. And today it kind of still is. And I think it goes back to what you were saying, Eric, is that back in the 70s, or back in the 80s, when you looked at somebody, you said, okay, he has HIV.
Or she.
Or she. In this day and age, you don't know.
No.
So, and I guess because you don't see, you don't really think about or worry about. Right. And I think that's one of the biggest issues that we have right now in this community.
Yeah. Again, like I said, it's a catch-22. We've done great stride. We've made great progress, in preventing, but also treating, the disease. That it's hard to tell.
So, what would you say is the barrier to people really understanding certain things about the disease? Because there are a ton of misconceptions. But we're in the information age, and people have information at their fingertips. Right. So why isn't this information getting to the people that need it most? And let's talk about people here in Harlem who have smartphones. I see people walking around with iPhones and the Androids or whatever. Yeah. So people have the access to information. I don't even want to hear that anymore, that people don't have access, because it's there. You can look it up right now for free. Go to the CDC and you can get all the information you want. But why aren't people as informed as they probably should be? And I know it's a tough question, but
no, it's not. It's kind of a complicated question, really, to answer, because I don't think that people are not informed. I think people are informed. Again, one of the catch-22s of the great advances that we've made is that people are not so worried about being HIV infected. And I can tell you this because, there's a good amount of people that we test. And, by their reaction before, we had to, back in the early days, doing counseling and testing, we had to do this whole process of prepping, someone to receive those news, et cetera, because the normal reaction used to be, it's like, oh my God, either I'm going to kill somebody who gave me this, or I'm going to kill myself. Nowadays, there's a good number of people that we test, and once you give them the result, they're cool, calm, and collected. There is that initial shock. That makes you think, okay, either this person already knew, right? Or this person is so empowered by information that they know that it no longer means a death sentence.
So funny, I'm thinking is that I remember about a couple of years ago when I went to go get an HIV test. I went to get my test, and I had to come back the results, and I was sitting in the waiting room, and they was like, sir, I'll be right with you. So I was sitting there waiting. 5 minutes went by, 10 minutes went by, a half an hour went by. Now I'm getting scared.
Right.
I was like, okay, they're going to come out. They're going to tell me. I was sweating. About 40 minutes later, she was like, you still here? She forgot to come out to tell me.
Wow.
She was just like, my apologies, sir. I'm so sorry. Mind you, I'm black and blue.
That had to be nerve-wracking. Yeah.
So, and I believe that individuals sometimes may have the knowledge, but just don't want to know because of the fact that, okay, now I know, what am I going to do?
Right.
thought process.
All righty. Ladies and gentlemen, you're listening to Health in Harlem on WHCR 90.3 FM New York, the voice of Harlem. If you have any questions, comments, or concerns about tonight's show, you can call us at 212-650-6903. That's 212-650-6903. And you can hit us up on Facebook. Type in Health in Harlem in the search box, and we'll pop right up. And you can leave your question, your comment, or concern there. We'll be right back after this break. Stay with us.
WHCR 90.3 FM, New York.
For a twist on a seasonal classic, the Apollo Theater presents Duke Ellington's Nutcracker Suite and Sacred Music in the show Ellington at Christmas, featuring Savion Glover, Keith David, Liz Wright, Priscilla Baskerville, the David Berger Jazz Orchestra, the Abyssinian Baptist Church Choir, and students from the Dance Theater of Harlem. That's Ellington at Christmas, Saturday, December 7th at 3 p.m. and 8 p.m. Tickets are available at Ticketmaster.com. For more information, visit www.apollotheater.org. According to recent statistics from the New York City Coalition Against Hunger, an average of 1.5 million New York City residents, in which 1 of 4 are children, live in households facing food insecurity. The coalition's latest annual survey indicates that local New York City's emergency food providers, such as food pantries, soup kitchens, and brown bag programs, reported a 20.8% increase in need for their services due to the city's recent recession. The Harlem Hospital Center Department of Food and Nutrition Services wants to help curb these alarming statistics this holiday season by conducting its annual food drive. From Monday, November 11th through Tuesday, December 24th, there will be donation receptacles located throughout Harlem Hospital Center. All donations will be shared with the Harlem Mothers Save, Stop Another Violent End. If you have questions, feel free to contact Mr. Sean Shivers at 212-939-1936 or Chanel Rogers at 212-939-1935.
WHCR 90.3 FM, New York.
Welcome back to Health in Harlem, ladies and gentlemen. I'm Maurice Selby.
And I'm Sean Shivers.
And tonight we have an administrator from the HIV Services Department at Harlem Hospital.
The one in charge, the professional.
Yes, Mr. Eric Wilson.
Thank you.
And we are talking about HIV/AIDS awareness, ladies and gentlemen, in honor of World AIDS Day. And we have a caller.
We did, but it stopped.
Oh, it stopped. All right.
Yeah.
So,
call back.
There was one thing that Mr. Wilson said before we went to break, and he said that people are informed. For the most part, people know or have an idea as to how this disease is transmitted. People understand that there's treatment, which is why, and he said that they don't even have the reactions that they used to have when finding out that one is HIV positive. And you know what, though? The way I feel is that there's certain subtleties to this disease that people need to be aware of as well. And there are some misconceptions out there that put people at risk. Even though they do have a good fund of knowledge regarding this disease, ways to avoid it, risk factors, things of that nature, there are still certain things that people don't know or that they think they know that could put them at risk. And Sean, I know you have some of them written out.
Not today. I thought I did.
I
don't have the paper.
Okay.
But I was just having a conversation with Eric, and he has quite a few. So you can just start throwing them out there.
Yeah, it's like I mentioned earlier. How some folks back in the day, they used to think that you could catch HIV by just being in the vicinity of someone that they suspected or had HIV or AIDS. drinking after someone that has used the glass, using utensils. People didn't want to, folks back in the day. I say back in the day like it was so long ago, really, and that still happens actually, and we still get some people reporting stuff like that. But I mean, someone that was open to their families and mentioned that they were infected. I mean, the family prepared a separate set of utensils, plates and stuff like that, because they thought that they could, catch the disease that way. There's also a lot of, things related to different cultures. For example, preventing disease. Some cultures believe, horrifically, that by having sex with a virgin, they would be cured of HIV infection. I mean, that's
what culture is this? I'm just curious.
Which is still
some African,
some parts of
Africa. Yeah, believe stuff like that. And I say horrific because I mean that's just demonstrates the lack of knowledge, of information, education that some people still, some places, some cultures still have.
I got two. I mean, and I noticed the standing out that someone probably wants to know. First of all, as far as life expectancy, if you find out that you have HIV or AIDS or HIV. How long can you continue to live a normal life up until your 70s or 80s? Or, I mean, because some people think that sometimes it's a death sentence.
Right. No, absolutely, man. The life expectancy of someone that is infected with HIV, it's up to them. As long as they...
So there's hope.
Oh, absolutely. Yeah. Like I said, the treatment nowadays is, it's amazing. Someone can live a normal, very productive life, just like, anyone that is not infected with HIV. Just as long as they follow their treatment, the regimen, take medications as prescribed, see their doctors regularly, live a nice, healthy lifestyle. Exercise regularly, eat right. But yeah, and again, that's what I was saying earlier. We were talking about how that's really doesn't mean much. I mean, you see, guys. I know guys that that we work out in the gym and whatever, and they look so physically fit that. No one would even guess. No one would suspect. Very active, very very athletic in sports, and So again, I say that's really up to the person.
You're right.
So let's talk about this. One major misconception revolves around the issue of testing. And, there are individuals that understand the importance of knowing their status regarding HIV, whether or not they're positive or negative. And they go and get the test, as they should, and find out that they are negative, right? And this is great. This is a great thing, apparently.
And they never have to go back.
And they never have to go back. So that's one thing, is that this is something that, especially in high-risk groups or individuals engaging in high-risk behaviors, i.e. unprotected sex, IV drug abuse, and other activities, these individuals need more than one test. We need to go back and get repeat testing. And, there are times where individuals find out that, okay, I'm negative, so I'm negative, I'm good. But
I have a question on that.
Yeah, let's talk about
So is it true that if you get a test and it's negative, you still can have the virus in you, and it's always good to go back in about 6 months, especially when you think that someone could have gave it to you? Is that true?
And that's another misconception I was going to bring up. Yep.
Right. What you guys are referring to is the window period that exists, where, typically it could happen that you, depending on the risk behaviors, the risk factors of an individual. So if you just routinely have your HIV test, you're practicing safe sex, but you decide, hey, you know what, let me get it, let me be tested, just for the sake of it, and you come out, your result is it's negative or preliminary negative. There's very little possibility that you would have to come back in 3 months, not 6 months, preferably 3 months. That window period is what we prefer to and be retested. Now, if you're an individual that habitually or continuously, continue to put yourself at risk or engage in risky behavior, then you should come back in 3 months, because you could be one of those folks that is, within that window period. So there's always, that's always a good practice to do. Yes.
I have a question. Well, I have this is for females out there who are HIV positive. Can you be HIV positive and still get pregnant and have a healthy baby? Or is it possible to have a healthy baby who is not infected? Is that possible?
Yes, absolutely. Okay. There are, of course, measures that you have to take. That you have to work very closely with your doctor to prevent, to ensure that you have not only just a healthy baby, but a healthy pregnancy, with no complications. But yes, absolutely, that is possible. There's, preventive treatment for you, especially in, at the time of delivery, for not you, but I mean the mother and the baby. But yes, we have, HIV positive women that give birth to babies, and babies, again, making sure that you take all these precautions. You have to work closely with your provider, with your doctor. But baby that is HIV negative, or if at the most that, there may be some risk of the virus being transmitted to the baby. The baby seroconverts mean that, it clears the virus. It turns out to be HIV negative.
So what about breastfeeding now? Because, I always say I wish I was breastfed. We always talk about it. But the question is about, you have a mother who wants to breastfeed her child, and she's HIV positive. Can she without...
that's
passing it on?
That's contraindicated. That's,
that's something that's recommended again.
Breastfeeding is one of the most common transmission of HIV virus from the mother to the child.
Oh, it is.
So that's why it's not typically it's not recommended.
So basically, a mother should not breastfeed her baby
if she's HIV positive.
Okay.
If she's HIV,
correct. I didn't know that.
So, but other than that, you should be breastfeeding the child. We got to throw that out there.
Yes.
Health in Harlem supports breastfeeding up to 2 years of old, just like the World Health Organization. Now, another misconception. We have an individual that is HIV positive, and they say, well, you know what? I already have the virus. I can do what I want now. I don't have to protect myself any further. I can engage in whatever risky behaviors because I already got the virus. It doesn't matter.
Isn't that against the law?
My partner has the virus. Huh?
Isn't that against the law?
I'm not saying that, like, deliberately
I know,
meeting people, but this is something that can be potentially dangerous because there are different strains of this virus.
Absolutely.
Some more virulent than others. And by virulent, I mean aggressive. And this could lead to serious problems for that individual or other individuals that they interact with.
Well, not even that. I was being serious when I said that. I mean, I believe I believe that if you are HIV positive and you have unprotected sex with a lot and not telling the individual, and they find out, they can bring you up on charges. Is that correct?
Yes, there is. Okay. You're kind of right. The sticky point to that is proving that you intended.
They intended to give to the person.
And someone could always argue, no, so, it's kind of funny.
I understand. Gotcha.
Yeah, it's very tricky, but there were cases in the past.
Yes, absolutely.
But the thing is to be careful because there are individuals that are in relationships with other HIV positive individuals, but you still need to be careful and protect yourself because the strain that you have might not be the same as the strain that your partner has. And this could even go as far as affecting the medications that you take, building or leading to increased resistance of these viruses to medication, and that could cause some serious complications.
You got this. You don't need to be here.
But Mo, this goes back to: do you believe that? Let's say about 10 or 15 years ago, people had that attitude that Mo just said. I have it, I don't care anymore. There's nothing I can do about it, so I'm just going to go and have myself a good time. But I think once the individual finds out that there is hope, you can live a regular life. You can live to be 80 if you take care of yourself. So that thought process is not going to change. As far as now, I don't want to get nobody infected. I do want to live longer. Do want to live a healthier life.
Mm-hmm. Yeah, you're right. I think there is a better, conscientious improvement. There's definitely folks nowadays are more considerate. They are aware that yes, they for whatever reason contracted the virus, but they don't want to put someone through the same thing that they're going through. So yeah, they will take measures. Whereas before, people were just, and it's understandable. You felt that you've been dealt a deadly hand. So you're just gonna take it out on the entire world. So you're just gonna go ahead and do everything that you can to give it or transmit the disease to other folks. I don't think that's we don't hear about that that much nowadays. So thank goodness for that.
And I think most people, the vast majority of people, are good people and don't want to do that. Don't want to hurt other people in that way. Right. And one thing that I want to caution everyone out there, because we did just mention that, but we don't want to fear individuals that are HIV positive. No. And people are HIV positive for different reasons. So you cannot necessarily judge somebody because they have this disease. You don't know what went on in this individual's life. As Mr. Wilson said, it just might be they were dealt a bad hand, if you want to call it that, because we have individuals that are functional in society, very good members of society. Absolutely. That maybe were born with this disease, and this is something they just have to live with. So caution against that. You're listening to Health in Harlem on WHCR 90.3 FM New York, the voice of Harlem. We'll be right back after this break. And remember, ladies and gentlemen, you can call us at 212-650-6903. We'll be right back. Stay with us.
WHCR 90.3 FM New York.
All in together now. We can make it better now. Come on, can we do it?
Yeah, you know that we can.
We'll rope it up,
cause we know how to jump.
we'll roll it out,
Cause we know how to skate.
we'll cut it down,
Cause we know what to eat.
we'll swap it out.
We eat healthy stuff.
Can we do it?
Yeah, you know that we can.
Can we do it?
Yeah, you know that we can.
Yeah, well come on.
Today's a good day to grab your kids and hang out with them for an hour. Dance, walk, play a sport, or cook a healthy meal. Because just moving a little and eating better every day can help make you and your child healthier.
Can we do it?
Yeah, you know that we can.
We'll ball it up,
Cause we know how to hoop.
we'll mess around,
Cause we know how to play.
we'll drop it down,
Cause we know how to dance.
we'll veg it up.
Veggie night and day.
Can we do it?
Search We Can online to find doable tips and activities that you can use every day to keep you and your kids healthy. Remember, that's We Can. A message from the Ad Council, HHS, and NIH's We Can program.
Hi, I'm Vinny B of the Vinny B Showcase. Tune in every Thursday from 8 to 12 midnight for some solid cultural roots music and some sweet lovers rock. Also, informative interviews and giveaways. Right here on the Vinny B Showcase every Thursday, 8 through 12 midnight on WHCR 90.3 FM. Peace.
WHCR 90.3 FM New York.
Welcome back to Health in Harlem, ladies and gentlemen. I'm Maurice Selby.
And this is Sean Shivers.
And tonight we have Mr. Eric Wilson. He is an administrator in the HIV Services Department at Harlem Hospital. And that's what we're talking about tonight, ladies and gentlemen. HIV/AIDS in honor of World AIDS Day, December 1st, 2013. But briefly, I want to have a moment of silence for Nelson Mandela. I'm pretty sure most of you out there in the listening audience have heard, he passed away earlier today. And I just want to have a moment of silence briefly. So one thing in his fight, or even during his fight against racial oppression in South Africa and throughout the world, Mandela also took on the challenge of HIV/AIDS in South Africa, and that led to a number of advances in the care that people are receiving over there. So we just want to shout that out as well in this program.
Now, Mo, now, you made me curious. So, can you give at least one or two? What are some of the advances? Do you know exactly?
I wish I could give you exactly, but just in terms of
you can ask questions like that on this show.
I know. But in terms of promotion of awareness, that was one of the major campaigns, and also getting these antiretroviral treatments to
absolutely
people in South Africa, not just in South Africa, but Africa as a whole.
Right.
He had a key role in that.
Yeah, absolutely, because it brought attention and caused the powers that be, both in this country and this continent, as well as in the continent of Africa, to take a look at this situation there, and provide treatment, offer treatment and education for folks.
You will. And I don't want to get off the subject because I know that we're about to talk about hepatitis C, which is serious in this community. But I want to give a shout out to, and I know she's probably not here, and to Alicia Keys, because she came to Harlem Hospital Center.
That's right.
I believe I was on vacation, and I said I'm still going to go to this forum. Women's Empowered, and forgive me if I'm saying it wrong, but it's basically empowering women with HIV and AIDS. She had a forum at Harlem Hospital. I was right there in the middle of it watching, and the thing that she brought to my attention during that whole segment is that individual children who are born with HIV and AIDS are sometimes lost in the mix. And I say lost in the mix is that you don't know, and they're going through their own struggles. And the one young lady who got up, and she was just like, I'm a survivor. I was born with it. And she was like about 18, 19, whatever. But it just put something in my head that there are a lot of individuals who was born into this and didn't even ask for it. So I just want to just say that.
Right.
All right, ladies and gentlemen, as you heard Sean say, you are going to get a 2-for-1 deal on this show tonight. You learned about HIV, learned a good amount of information about HIV, but we're also going to talk about a closely related illness, hepatitis C, another viral infection that could lead to some really bad problems. And you might not even know this is going down for a good amount of time until it is too late. So, Mr. Wilson, could you just introduce us to hepatitis C, and why is this such a major concern here in Harlem?
Okay. So, kind of similar to HIV infection, the transmission of hepatitis C, follows the same route, blood to blood.
Body fluids.
Right. Infection, modes of infection. So, but basically, some key differences about hepatitis C is that hepatitis C, works silently, and hepatitis C is a disease, it's a viral infection, as you mentioned, Maurice, that affects the liver. It could cause severe damage to the liver. And because if people are not aware that this is happening, they're not going to their doctors, having regular checkup and ensuring that their doctors test them, screens them for hepatitis C, this could go on and on and on for years and years. And by the time you get to find out, it's either a little bit difficult to treat it or, nearly impossible at all, requiring, liver transplants and, whole host of liver diseases that an individual can suffer from.
Now, I guess to let the community know how serious this is, what is the purpose of the liver? What does the liver do for the body?
So the liver does a bunch of different things, and one of the major things is this is the major detoxification organ in your body. Along with the kidneys, the liver filters out a lot of harmful things and breaks them down into less harmful things so that your body can get rid of it, either through your poop or in your urine. But one of the first stops, though, for a lot of potentially harmful chemicals is they go to the liver where they are broken down, and then your body can get rid of it as well. That's one of them. But it also does a number of different things as well, including it's a place for extra fuel for your body. When you haven't eaten in a while and your glucose levels start running low, your liver has glycogen stores, what's called glycogen, that it breaks down to give you more glucose in your body.
So
it's let's just say this in general. The liver is a very important and cool organ in your body. One of the coolest organs, if you ask me, because it can regrow too. If you chop a piece off, that's just a cool fact.
So Eric, can you tell us what does hepatitis C do to your liver?
Like Maurice was mentioning, one of the main things is that it causes cirrhosis of the liver, which is basically, your liver breaks down. It I don't want to sound gross out, but it rots out. Basically.
I think that's a good way of putting it.
Yeah, right? be real. We're real on here. Yeah.
And the again, one of the, so if this is happening, to your liver, like Maurice was mentioning, your body will not be able to, detox chemicals and things that go through it. It won't be able to produce certain chemicals, certain enzymes that are key, important to the body. So that's why it's important, to ensure that good liver health and.
So basically, so now this hepatitis C. Oh, well, I guess when you have cirrhosis, most of the time when you think of cirrhosis of the liver, you think of alcohol. You're drinking alcohol, it's destroying your liver. This hepatitis C is something that's in your body, and it's probably doing the same as that thing alcohol is doing, but you're not drinking alcohol.
You're not drinking alcohol, and it's just happening over a long period of time, a little bit of damage each and every day. And not only cirrhosis, but you can develop cirrhosis, which is a very serious illness, which can be fatal, and I would say in most cases is fatal. You can also develop cancer of the liver as a result of this as well, this infection. And I think really what we need to talk about is people that are at very high risk of developing this disease. And these are individuals that don't get a lot of press. We don't know a lot about these individuals, and when I'm talking about men who have sex with men, this is something that is swept under the rug. I think a lot of times, especially in the African American and Latino communities, this is something that nobody wants to talk about in our communities. But this is the fact of life. Men who have sex with men are at higher risk for HIV transmission. They're at high risk for hepatitis C infection. They're at higher risk for even syphilis. We're talking about an old school disease.
But Mo, I just heard on the radio, and I heard this on the radio, that they said that black females, heterosexual females who have sex with heterosexual men, that the HIV is soaring high in those females. I just heard that last week on the radio,
and I believe you. I think that's certainly true, and in part though because of this issue as well.
Connection.
Men who have sex with women. We're not just talking about strictly gay men. We're talking about bisexual men. We're talking about men that that are transvestites. We're talking about all of these different groups of people, but they're at higher risk than the average heterosexual male in society.
Now, the question now that I have, I'm going through it, we have a few more minutes, is it higher within those men because of them being promiscuous, having a lot of partners? Is that the reason why HIV is higher in men who have sex with men, or because why is it high within that category? As far as I don't know. I'm just throwing it out there.
It just boils down to behavior.
Behavior.
Yeah, it just boils down to behavior.
Yeah, that's definitely a major part of it. From what I understand, is that there are men who, as we just said, men who have sex with men that don't call themselves gay because they have heterosexual relationships as well.
Call it, yeah, okay.
And they do tend to engage in, I guess, riskier behavior because they might have multiple partners. One might not always use protection because they think this is a safer way of having intercourse. And also, even looking at it anatomically and physiologically, they are at greater risk because of the ways in which they engage in intercourse. They can end up exchanging more bodily fluids than a heterosexual couple, and that the more fluids you're exposed to, the more contact that you have with an individual in that level, the more likely you're.
Did you just discuss this in class? Because you're talking like you just had a conversation like this in class. As I thought, you just had a lecture on this.
No.
Well, it is also on top of what you've just mentioned, Maurice. Again, I go back to behavior, and I'm not saying that men who have sex with men misbehave any differently than others.
Exactly.
It's just that we have to keep in mind that folks that are engaged in this kind of behavior, there's usually other things happening, other mental illness, substance abuse, that causes that type of behavior. So we don't want to, or I don't want to, label men who have sex with men as that just because of
I'm with
have
you on
sex
that.
with men. Again, it goes back to whatever it is that they have, other comorbidities that they may have that causes that risky behaviors and promiscuity.
True story. Ladies and gentlemen, you're listening to Health in Harlem on WHCR 90.3 FM New York, the voice of Harlem. We're going to take our last break for the evening, try to make it a very, very short break. Remember, you can call us at 212-650-6903 if you have any questions, comments, or concerns. That's 212-650-6903. We'll be right back. Stay with us.
WHCR 90.3 FM New York.
According to recent statistics from the New York City Coalition Against Hunger, an average of 1.5 million New York City residents, in which 1 of 4 are children, live in households facing food insecurity. The coalition's latest annual survey indicates that local New York City's emergency food providers, such as food pantries, soup kitchens, and brown bag programs, reported a 20.8% increase in need for their services due to the city's recent recession. The Harlem Hospital Center Department of Food and Nutrition Services wants to help curb these alarming statistics this holiday season by conducting its annual food drive. From Monday, November 11th through Tuesday, December 24th, there will be donation receptacles located throughout Harlem Hospital Center. All donations will be shared with the Harlem Mothers Save, Stop Another Violent End. If you have questions, feel free to contact Mr. Sean Shivers at 212-939-1936 or Chanel Rogers at 212-939-1935.
Hi, I'm Vinny B of the Vinny B Showcase. Tune in every Thursday from 8 to 12 midnight for some solid cultural roots music and some sweet lovers rock. Also, informative interviews, and giveaways. Right here on the Vinny B Showcase every Thursday, 8 through 12 midnight on WHCR 90.3 FM. Peace.
Tougher than rock. Said I'm black. I'm tougher than rock.
WHCR 90.3 FM, New York.
No one tries to say misunderstandings taken to the
People are
grave.
hurting deep down inside, trying not to show it because of foolish pride. But pain is a sickness that is hard to cover, and it's the reason.
Welcome back to the one and only Health in Harlem on WHCR 90.3 FM New York, the voice of Harlem. I'm Maurice Selby.
And I'm Sean Shivers.
And tonight we have Mr. Eric Wilson. He is an administrator in the HIV Services Department at Harlem Hospital. And we are talking about HIV, AIDS, World AIDS Day, and we even threw in hepatitis C as a bonus. Because that's a very important
You said
disease.
a bonus.
Well, I mean, it's bonus knowledge. Let's say that.
Right.
Bonus
Oh, wait.
knowledge that
Don't
we're
be
giving
stingy
out.
with it. Make sure you pass it on.
Right.
Yeah. So I guess we're going to jump right into real quick a couple of things. So what are the services that they offer at Harlem Hospital and in your area?
I'm glad that you brought that up because, we can mention in Harlem Hospital. Harlem Hospital, as you guys know, is a bedrock, in our community in terms of healthcare. There's an incredible wealth of services that are offered in our facility. And under my department, or the department that I work under, the Division of Infectious Diseases, that's where HIV services falls under. We have this wonderful one-stop shopping kind of thing, service where we offer in the same, within the same, under the same roof or right next door to each other, mental health, HIV testing and treatment, of course, and Hep C that we're touching on. And a lot of supportive services, especially for the population that we serve. People that come, the kind of population that we serve, as I was mentioning earlier, usually come with other things attached. So we try to provide that support. We provide that service, entitlements, housing, referrals for other things that we may rarely not do. And I say rarely not do because we try to keep everything, either within our department or within Harlem Hospital per se. As I say, again, Harlem Hospital is a wealth of services that that are provided. We also are tied to a couple of offsites, of course. Renaissance is our sister offsite satellites, but also there's a site on 125th Street, and people can call and
Signingham?
No, it used to be Signingham.
Okay.
But what I'm getting at is where they conduct certain studies, clinical trials and services for HIV related. It's some wonderful things. Some studies that that prevent the transmission of HIV services if some people run that risk of having risky behavior. There's something called PrEP, and that's something that we can talk about. Another segment is basically pre-exposure prophylaxis. To prevent or help reduce the risk of HIV infection, people who engage in unprotected sex, for example. So that's one of the things. But again, I just want to keep emphasizing that Harlem Hospital is a tremendous wealth.
And ladies and gentlemen, we got Vinny B from the Vinny B Showcase in the house. He got a question.
Yeah, my question is, good evening, Doc.
Hello.
Okay, my question is, you just said a while ago how to prevent people from getting HIV.
Yes, sir.
Other than using a condom, is there another way?
The other way that is recommended and it doesn't really work is abstention.
Okay.
Abstinence.
So the only safe way you gotta use the condom.
They've been experimenting with various sort of like similar to like spermicides, various gels and creams that you can insert into the vagina and put around the penis to sort of kill or degrade the virion, the virus. But these things are still experimental, haven't been shown to be very effective. And I can't say that they're not improving. They've been showing some promise, but they're not as effective as either abstinence, the number one.
Okay. So my other question is, those things you just mentioned a while ago, how did they prove the validity of it? Did they let somebody who's not HIV positive had sex with somebody who is?
So they did exactly what you walked in at a good point of the conversation, because I was going to talk about the importance of clinical trials, clinical studies, and Mr. Wilson was just talking about that. And basically, they tracked infection rates amongst individuals that were using these different things. So individuals that used condoms versus individuals that used these gels. Then they would see who got infected or how many individuals got infected by using
the gel.
Is that what you're going to say, Mr. Eric Wilson? Would you going to say the same thing?
Kind of, sort of, yeah, because, Maurice is right. There is something called, PEP, post-exposure prophylaxis, or pre-exposure, which is what I was mentioning too. But basically, these are medications that people can take to reduce the possibility of the incidence of being infected. Now, you asked a very important question. Why would people do that? Why would people have unprotected sex, knowing that they could possibly? Because, again, like we mentioned earlier, human behavior.
True story.
We know that people do this. We know that people, in spite of being informed, being provided, materials like condoms, free condoms, free services, people still engage in these risky behaviors. So they said, you know what? Why don't we try this? People are doing it anyway. Why don't we have them try this, and let's see if that prevents?
Well, so funny. It's funny too, because think about it. We are human beings. We are mammals. Having sex is part of our DNA. That's how we reproduce. So to tell somebody that you can't anymore, and if you do, you have to do it like this. I mean, I think that sometimes when you're in that mode, sometimes you just simply forget. And I'm not making it as an excuse, but I'm just saying having sex is something that's supposed to be natural. And now
we're supposed to do it.
And now we're being conditioned and told that we can't do it. It has to be done in a certain way because of the disease. It's crazy. Yeah. It's crazy.
Yeah, but again, it's a reality.
Yeah.
It happens.
It's a reality, and that's the thing. Nobody's trying to tell you how to live your life. What we want to inform people of is how to live a healthier life, a more productive life, because if you get an infection like this, we have all of these nice treatments nowadays. People can live productive lives with HIV. However, you can talk to an HIV infected individual and they'll tell you that it makes things a little bit more difficult than it has to be.
Right.
And you don't want to be tied down to pills, taking these pills every day. And then if you miss one, then you really got to recoup, because now the virus might develop some sort of resistance and you might have to change the medication, which can be a headache as well. And these medications are not totally benign. They have side effects, just like any other compound or foreign agent that you put into your body. It can react with you in certain ways, and they might not always be good ways. So you don't want to have to take this medication if you don't have to.
So
this is why we saying protect yourself. First, know your status. We got to get tested. And once you know your status, as Miss Thomas said when she started this show, guard your status with your life. Once you know, you guard your status with your life.
I was just going to say, it's a perfect segue to what Maurice was saying, how I just want to ensure to end the session. Prevention, is key. And the best form of prevention is knowing your status. Get tested. Folks, get tested.
Yes.
And it's free in a lot of places.
Oh, absolutely.
Nowadays,
and it has become such a routine. That people no longer are hiding, in shadows when they're offering or they're requesting a test. People just come right out. Yeah, I want an HIV test.
So funny. Don't get me wrong. I believe that, and quote me if I'm saying this wrong, I believe that Ms. Soares said recently at a meeting that all PCPs at Harlem are now mandated to give an HIV test to all of their patients now.
Yeah, what you're referring,
it's part of the process.
What you're referring to is it's a law.
Okay,
it's a law, now. It is to offer the test.
Offer the test. Gotcha.
Yeah, people have to in every emergency department, in every triage and medicine settings, we have to offer the test.
So hopefully one day, because we keep hearing about this hepatitis C, that may be something that we need to.
No, that's the law already.
That is the law.
It's already enacted for Hep C to offer the test for Hep C, and that's also what I wanted to mention.
Excellent.
Especially for the baby boomer generation, people born between 1945 or 65 or something like that. The baby, so it's mandated to offer the test of people that go into a medical setting to be screened for hepatitis C. So again, it's key. Testing, and again, I say Harlem Hospital. It's a great resource for all these kind of things.
Is there a number that that the community can call for more information?
1 second.
Sure. WHCR 90.3 FM, New York.
We need just 60 seconds, Vinny. Is there a number that the community can call for more information?
Sure. Our main office, our main clinic number is 212-939-2910, or the HIV hotline is 212-939-8330.
Yes, 8330.
All right. Thank you very much, Mr. Wilson, for joining us tonight and sharing this wonderful information with our listening audience. Thank you very much, Sean Shiver. It's good to see you again, man.
Thank you, my brother. And real quick before we go, please, everybody, make sure you tune in next week. My girl, the preacher's wife, is going to be here, Ms. Dr. Joan Culpepper Morgan, and we're going to be talking about colon cancer screening. Don't be embarrassed to death. So make sure you tune in next week for that segment.
And ladies and gentlemen, unfortunately, I have to inform you I will not be present next week.
Why not?
I have an interview in ATL.
Our future doctor.
It hurts.
It's all good, though, brother.
Show. But I will be here in spirit, and I'll even try to call in.
Yeah, I want you to call in because we're going to be cracking up next week. Me and Dr. Culpepper Morgan.
And thank you, Vinny B, for the question that he asked on air. It led to a new direction in conversation. Yes. And we want to thank you, the listening audience, for tuning in. This show is, and we got to thank Miss Valerie Wright. She's the producer of Health
my
in
girl.
Harlem. This show is dedicated to the memory of Miss Gloria Thomas. And you have the Vinny B Showcase coming up next, ladies and gentlemen. He's in the studio and ready to go. Harlem, take care of yourself.
WHCR 90.3 FM, New York.
Can't you see the sign of the time we're living in? Got to use it every day. It's what we need today. We got to use it every day. It's what we need today. Wisdom and knowledge.